Today I'm going to demonstrate the correct clinical procedure for the placement of a resin fissure sealant. The clinical examination revealed that tooth 4-5 has a stained but sound fissure, and the caries risk assessment indicates that this patient would benefit from having this tooth fissure sealed. The most important thing to remember is that effective isolation is the most critical part of this clinical procedure. The fissures are cleaned using a slow speed handpiece and a dry bristle brush, dried, and then inspected to ensure that they are free from debris. Cotton wool rolls are placed lingually and buccally to isolate the tooth, and then the tooth is dried again. The next stage is to etch the tooth. 37% phosphoric acid etch is applied to the fissures using a microbrush, trying to keep the etch confined to the fissure pattern. Acid etch has the potential to cause burns, so care must be taken when using it to avoid injuring the skin and soft tissue. A ball-ended instrument can be used to gently tease the etch into the fissure pattern. In this case, a die-cal applicator is used. The etch is left on for 15 seconds before gently washing off with a 3-in-1 syringe. When rinsing, care must be taken not to blast the acid etch off the tooth onto the surrounding skin and soft tissues. Once the fissures of the tooth and surrounding areas are completely free of etch, this can take up to 10 seconds of rinsing to remove the etch effectively. Remove the cotton wool rolls and replace with dry ones, ensuring that the tooth does not get contaminated with any saliva. If saliva contamination does occur at this stage, you will need to re-etch the tooth using the same procedure. If the etched tooth is contaminated by saliva, the resin material will not adhere to the etched tooth surface properly, causing the fissure sealant to fail immediately when a probe is run around the sealant, or over time as saliva leaches under the fissure sealant, causing either the sealant to be lost or caries to progress unnoticed underneath. Once the cotton wool rolls are placed correctly and the tooth is isolated, dry the tooth with 3-in-1 syringe. It is important to dry the tooth until the enamel has a frosty, chalky appearance. If you can compare the appearance of the etched tooth with the adjacent tooth, you can see a marked difference with the unetched tooth appearing shiny and smooth. Check that the moisture control is still effective. You may need to remove and replace the cotton wool rolls again, ensuring that saliva does not contaminate the etched tooth. Encourage your nurse to aspirate throughout the procedure, and remember that a saliva ejector can be placed lingually for the duration of the procedure if necessary. Using a microbrush that has been well wetted with the bond, apply the bond to the tooth fissures. Very gently blow air using the 3-in-1 to remove the excess solvent and disperse the bond. Do not blast the air on the tooth. The tooth fissure should now have a glossy appearance. Using the curing light, place the tip of the light as close as possible to the tooth without touching it, and cure for 20 seconds. The orange safety shield must be used to avoid damaging the eyes with the bright curing light. Again, check that your moisture control is still effective before you proceed to the next step. Using a die-cal applicator or other suitable instrument, apply the fissure sealant resin to the fissures of the tooth. The resin should flow from the applicator into the prepared fissures. Gently draw the resin into all the fissures to be sealed with the applicator, keeping the sealant within the fissure pattern. Take care not to overfill the fissures with the resin and avoid introducing air bubbles. Once the fissure sealant is placed, check that the resin has filled the fissures, there are no air bubbles, and there is not any excess leaking onto any of the adjacent teeth. If there are any air bubbles, these can be gently popped with a probe, and if the tooth is overfilled, use a dry microbrush to carefully remove the excess resin. Cure the fissure sealant as before, placing the tip of the light as close to the tooth as possible without touching it, and cure for 20 seconds. Using a probe, firmly run the tip round the margins of the fissure sealant to ensure that it is correctly bonded. If the fissure sealant lifts, fractured, or is removed at this stage, the whole procedure needs to be repeated. Once satisfied that the fissure sealant is correctly placed and properly bonded, use a damp cotton wool pledget to remove the sticky polymerization layer. A small smear of toothpaste can be rubbed over the fissure sealant to help lessen the taste of the new sealant. Remove the cotton wool rolls and let the patient rinse their mouth and ask them to feel round the tooth so there's no sharp edges.